It was designed to save Michigan drivers on their car insurance, but reforms to the auto insurance law are hurting many who are already suffering.
The changes that went into effect last summer affect crash survivors who relied on that medical coverage, and they're finding it harder to get the care they need.
TV5's James Felton introduces us to one family that says the lower cost is coming at a much higher price.
He was in a head-on collision back in 2016.
As a result, Courtney Cooney's little brother suffered a severe traumatic brain injury.
He's left, nonverbal. He can't walk. He's a hemiplegic and, a lot of neurological issues because of that.
Cooney's brother is at home and needs round-the-clock care, something she says is more difficult now because of the Michigan No-Fault Auto Insurance Reform Act.
We've lost our agency. We lost our case manager. We lost our transportation. Family's limited to how many hours we can caregive for him.
That's because the law has a fee schedule that limits how much home health care agencies and rehab facilities can be paid or reimbursed for the care of patients like Cooney's brother.
Catastrophic auto accident survivors are definitely being left behind.
April Brown is with AdvisaCare Home Health Care. She tells me about 40 healthcare companies have closed since the fee schedule took effect July 1st, 2021. Brown says she worries about the financial health of AdvisaCare.
I would say it's not sustainable for much longer. I'm talking days or weeks, not months.
Brown tells me that leaves car crash victims with fewer options.
I have to say no every day, James, to taking care of someone. And I'm just going to tell you that the stories that we hear are heartbreaking.
State Representative Phil Green, who introduced a bill to reform the law, says we're all at risk of being turned away by healthcare providers if the unthinkable happens.
They might just say, whoa, 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 we're not going to pick you up as a patient because we're going to lose dollars and that's going to bring our whole business down. So that's what this bill fixes.
Because Green says these companies don't get a Medicare code. He tells us his bill resolves that issue.
These other agencies would be linked to either the Medicaid brain injury waiver program or the VA fee schedule.
Green tells me instead of recovering at home, these patients could spend weeks in the emergency room.
It is putting a burden on our whole healthcare system.
As for Cooney, she tells me her family is hoping Green's bill becomes a much-needed law.
It's just been, just devastating for us.
James Felton, WNEM, TV5.
The bill has been referred to the House Committee on Insurance.